Hello everyone, my name is Binta Boja. I am a family nurse practitioner. This video here is for the Gambian healthcare workers. The video is about COVID-19 screening, signs and symptoms of COVID-19 and preventative measures. As we all know, our beloved country, the Gambia, has been experiencing an increased number of COVID-19 positive cases and also its related deaths. So I have been screening COVID-19 for some time, since the beginning of pandemic. I have learned that COVID-19 can manifest in so many different ways, way different from what we have learned at the beginning of the pandemic. It can mimic so many illnesses. So we as healthcare providers, we need to pay attention. We need to be proactive. So I am hoping that after listening to this video, it will help you Gambian healthcare workers to effectively and efficiently screen patients in order to control this deadly disease. So the signs and symptoms that I have been seeing in the patients, of course, upper respiratory symptoms that we all know, that is sneezing, cough, runny nose, shortness of breath, headaches, fever. Okay, apart from these symptoms, I have seen patients, which is, I found it very, very impressive. I've seen patients with fever, 100, 101, and rash. And the patients will tell me the rash, the rash comes and goes. It's not something, sometimes they even come to the clinic with no rash on. But they will show me in their phone, like they will have the picture of this rash that will come and go. So please, if you see patients with these symptoms, just be proactive and, and have COVID at the back of your mind. I have also seen patients with nausea, vomiting, and diarrhea and fever. Some patients will just have nausea, vomiting, and fever. Some will only have diarrhea and fever. I have also seen patients with stomach pain and fever. And then, of course, sore throat is there. And then, what else? I've seen patients coming in with mild fever, low-grade fever, 99, mild headache, and chest tightness. Some of them will tell me I'm having like chest pain, like vague chest pain. If I do chest x-ray on these people, I will see infiltration, meaning pneumonia. And the radiologist, after they read it, they'll be like, pneumonia, COVID likely. And of course, if I screen these patients for COVID, they will come back positive. So I have mentioned sore throat. I've seen a lot of patients coming in with sore throat and fever, a mild cough or dry cough. If I see these patients, I do not only screen them for COVID. I also screen them for strep. So if their strep is negative, if their rapid strep is negative, I go ahead and send culture and also send COVID. Even though we are in COVID pandemic, I do not only screen them for COVID and forget about strep. So I mentioned this part because we are in the peak season of malaria in the Gambia. And there are also other illnesses going on in the Gambia. So if patients present with all these symptoms that I have mentioned, please do not screen them for only COVID. Rule out other illnesses also, because it will help us tremendously. And I also would like you guys to basically screen everyone if you guys have, enough screening. I'm saying this because COVID is it's like we don't even know what to expect from it. The signs and symptoms are very vague. Some people will just come in with just weakness. I know that, the screening tests are very, very limited. However, if you guys have enough with you at any given time, screen patients that you are seeing for COVID. If they present with any symptoms, please screen them for COVID. because I found out that that has helped me a lot for in identifying positive patients. And in these patients, if we start treating their symptoms early, even though there is no treatment for COVID, but symptomatic treatment do prevent them from progressively getting worse. So it's very, very important for us to screen them early and and treat their symptoms early in order to prevent them from getting worse. My next topic with preventative measures. I have also seen on the papers that so many healthcare workers in the Gambia are becoming positive for COVID-19 or coronavirus. What I have seen help us here in the US is making mask mandatory among healthcare workers within the clinics or the hospitals. Everybody in the hospitals, from the secretary, the security, to medical providers, everyone is wearing masks and practicing social distance, because the clinics or the hospitals, I don't care wherever you are in this world, you can be in the Gambia, you can be in the US, these clinics are the deadliest places. So it's very, very important for us to have that at the back of our mind and try to practice the preventative measures as much as possible. If you are in the clinics, wear a mask. Do not think that your coworker is immune to COVID. Do not think that you yourself you are immune to COVID. It is very, very important for us to prevent ourselves as healthcare workers, because the healthcare workers are we are not the greatest at seeking help when it comes to our health. So we need to do what we can do at the moment to prevent ourselves. If you guys have any symptoms, any nurses or any other healthcare worker, if you have any symptoms, please communicate these to your leaders, your supervisor, your manager, or whoever is managing or leading the clinic, so that you can get screened. Because if you have COVID, you the healthcare worker, you can give it to your coworker, you can give it to your patients, you can go home and give it to your family. So it's very, very important for us to be proactive as healthcare workers, in order to prevent ourselves, like I said, our family, our patients, our community. I will stop the video here, and thank you so much, guys, for listening to this video. I hope it will help you in combating this deadly disease.